that a solution has eluded Congress for so many years?
Well, listen, health insurance obviously is one of the most complex issues facing the country. We've seen obviously the difficulty in addressing costs with Obamacare. But to me, there's a number of pieces of legislation that we should be looking at. For instance, PBM reform. That is something that is bipartisan, that we were able to negotiate language at the end of last Congress. It almost passed and then got blown up by Elon Musk in the final weeks of the 118th. We should be bringing that legislation back to the floor to reduce the cost of prescription drugs. When you look at what the president is doing right now on Most Favored Nation, we should enshrine that into law to make sure that the American people are not paying more for prescription drugs developed and manufactured here in the United States than our European counterparts, for instance. When you look at health insurance, we need more competition. If you only have 3, 4, 5 insurance companies available in your state and you're not actually allowing the free market to work, that drives up costs. So people should be able to purchase health insurance plans across state lines. When you talk about small businesses and wanting employers to provide health coverage,
I do just want to stop you because we have a limited amount of time here, and I hear your ideas. But I mean, I covered the passage of Obamacare as a congressional correspondent, which sort of dates me. But these ideas, a lot of them, they aren't new. Congress has had a lot of time to tackle these. Republicans certainly have. This idea of repeal and replace with what, right? Speaker Johnson told CNN's Caitlin Collins a couple weeks ago that Republicans have proposals ready to address health care subsidies. Have you seen anything of substance that is actually ready to go rather than just kind of throwing out ideas? Because that's really tough to make into action at this point in time.
Well, again, I was walking through a series of bills that we can actually bring forth immediately, and I would support. I'm not advocating
but those
for
proposals, he's talking about proposals
Obamacare.
That there's a difference between bills.
Well,
excuse me, because I've let you talk a lot, so I want to ask you this. He's talking about proposals that are ready to address subsidies, and this idea of proposals. Is there anything like on paper that is ready to go, not just ideas of bills that could be introduced? I mean, is there stuff that's ready to go out the gate?
Well, again, we have multiple committees that deal with health care and health insurance, energy and commerce, and ways and means.
And how far are they from a markup?
Have hundreds of bills, both of which. Okay, can you let me answer the question? Both of which have hundreds of bills that have been introduced that can absolutely be brought to markup. When you're talking about these issues, they are extremely complex. And trying to unwind, frankly, the damage that has been done to the insurance market by many of the provisions of Obamacare is no small task. I'm not advocating to repeal and replace because we're 15 years into this, and doing so will create more harm than good. I think the question is, how do you actually fix the insurance industry and the insurance markets? They need to be regulated. For instance, United Healthcare owns a primary care practice. That should be prohibited. That should not happen. You should not have an insurance company owning a healthcare practice. So there are things